Hello everyone and welcome to my YouTube channel Perfect Lab. In today's video, we are going to look at antibiotic susceptibility test, which is an important laboratory procedure used to determine the effectiveness of antibiotics against bacteria. So in this video, we will look at what antibiotic susceptibility test is, its objectives, some common methods that can be used to perform this test, and the factors that can affect the accuracy of the antibiotic susceptibility test result. So let's get started. So the AST, or the antibiotic susceptibility test, is a laboratory method which is used to determine the sensitivity or the resistance of bacteria to antimicrobial agents. And the AST results basically help to select the most effective antibiotics for treating bacterial infections. Principle of the antibiotic susceptibility test. So in the AST, the test is based on the ability of antibiotics to inhibit the growth of bacteria. So when bacteria are exposed to antibiotics, susceptible organisms are inhibited to produce a clear zone of inhibition as shown over here. So whilst resistant organisms continue to grow and as a result produce small or no zone of inhibition as shown here. So in the AST test, the result susceptible or sensitive means that the antibiotic has the ability to inhibit the bacterial growth to produce a clear zone of inhibition around the disc as shown here. And the result resistant also means that the antibiotic does not have the ability to inhibit the bacterial growth, and as a result small or no zone of inhibition is being produced as shown over here. So in AST, the size of the zone of inhibition is measured and used to interpret whether the bacteria are susceptible, intermediate, or resistant to the antibiotic used. The objectives of the antimicrobial susceptibility test. So one is to determine bacterial susceptibility to antibiotics by classifying isolates as susceptible, intermediate, or resistant. And two is to guide antibiotic selection to ensure the effective treatment of bacterial infection. 3 is to detect antimicrobial resistance in bacterial isolates. And 4, to promote the appropriate use of antibiotics to help prevent antimicrobial resistance. So these are a few of the objectives or the aims of running or performing antibiotic susceptibility tests. So let's look at some of the methods that can be used to perform these tests. So the first is the disc diffusion method or the Kirby Bauer method. The second step is the broth dilution method. The third is the agar dilution method. And the fourth is the gradient diffusion method. Factors that affect antibiotic susceptibility testing. So the first factor is the inoculum density. The second, the pH of the agar medium. The third, the potency of the antibiotic disc used. 4, storage of the antibiotic disc. 5, the incubation temperature and the incubation duration. And 6, the age of the bacterial culture used. So thanks for watching, and if you found this video helpful, please like, share, and subscribe to Perfect Lab. Leave your comments or questions below, and don't forget to scan the code on your screen to follow us on WhatsApp for more laboratory updates and tutorials. See you in the next video.